Okay, why don't we go to this case just to start with. And what I wanted to do is just talk about some basics of the software. On the upper left, you have the cross-sectional screen. Here's your axial screen. On the bottom left is your 3D reconstruction, which can show, the patient scan, and it can show scans of the models also that would be superimposed on the patient scan. And in the lower right, you have the panoramic view. And so these are the views that we have to work with. In the top right, you have what we call the tangential view, which is a really nice one because it allows you to control what cut, what slice that you see. If you look at the axial view, you can see the little green line with the triangle on the end of it. That shows you the cut. So right now, in the number 14 site, that's showing you a cross section. If I rotate the slider, now that's a tangential view, so that shows you very clearly the relationship between the implant position and this tooth. So between the two, you get a view of this implant 360 degrees around the implant as you go. So that's a really, really nice tool to use, called the tangential window. Over here are where you manipulate the software, basically. And on the right-hand side, there are all these different tabs, which I'll identify for you. And these tabs these are like macros, and these control the basic functions that you use. There's always two ways of getting to the tools that you use. You can use the toolbar up top with these icons, or you can use drop-down menus like this. So there's at least two ways of doing things. Sometimes there's three ways, because you can right-click on an implant, and then you get another drop-down menu by right-clicking on the implant. So why don't we just go through some of the first things you would do with a plan. One of the first things I'll do is I'll go to Panels. I'll click on Brightness Contrast, and you'll get this on the right side. Again, these are your macros on the right side. And you want to be able to see the plan clearly, and you can manipulate the brightness, and you can manipulate the contrast. And different scans on different patients have different characteristics. And so what you want to do is you want to manipulate the brightness and contrast to optimize your view of your patient scan. Also, for enumerating anatomical features like the inferior alveolar nerve, the adjustments of the brightness and contrast, you can optimize your ability to see the nerve in patients by playing with the brightness and contrast. So you might be able to plan the whole case just fine with a certain brightness and contrast setting, but when you go to look at the inferior alveolar nerve canal, it's difficult to see it, and then if you play with the brightness and contrast, you'll get that optimal combination that will give you your best shot at seeing that canal. And I'm talking about cases where it's not clear, or where there's the bone is not very dense and it's difficult to see the canal. That's just one example. The same thing goes for seeing the crest. With cone beam scans, sometimes the crest is fuzzy and it's hard to see it, and you can play with this to optimize your view. Okay? The other things you want to see here, surfaces is important. And as you see, when I click surfaces, it popped up this little panel over on the right side. Now, what's listed under panels is also listed on these tabs. So here's surfaces here, right there. See, brightness contrast is now listed on the right side. So again, there's more than one way of getting to it. So surfaces controls the 3D reconstruction. So here, the patient scan is called visible. And by clicking the box under visible, I can make it go away, or I can keep it. And then we scan in, as you know, we scan in models for you. Okay? So the models that are important to view would be marker. I'm going to turn off the patient scan. And when we say marker, when I can, and this is something that you should train yourselves to do, is I'll put a little divot in the model in the ideal location for the implant. you know, like this divot is probably 5.5 millimeters or so, 6 millimeters distal to this bicuspid, which is about the right spot for a molar implant. And I'll try to put that divot in the apex of the crest of the ridge. Now, this is being done without regard to where the bone is. And it's a reference point. It's a really useful reference point for virtual planning. And so we call this model with that little divot marker. The model without the marker is called tray. We also, and so you can turn these models on and off with under visible, check the box, or not. You can superimpose models as well. Now, we also like to use articulated models, and I just turned that on, and these models were hand articulated and scanned. As you know, we're trying to create a virtual articulator and more for treatment planning. And so by scanning in these models, we're able to do that. Here I'm superimposing the marker on top of the articulated models. So now there's other nomenclature that we use here. And sometimes we'll put in, I'll show you a case where we used a wax up. So you might see something over here called wax up. Or it might say future tooth. Maybe you'll send us a model of a patient wearing an RPD to use for future tooth position, and you know, that will be scanned in. We'll call that future tooth. It could be a model of a patient wearing a temporary bridge. So you'll see different nomenclature here, but you check the box to put it on, turn the image on and off. And you can superimpose these images also. So in this example here, I've just superimposed the patient's bony scan with the patient's soft tissue model. Now, the value of this is that if I click on this marker model and make it translucent, and I can adjust the density on the patient scan such that I get rid of the bone. So now I'm able to see this root. So I'm able to see the relationship between my implant and this root real life. And at the same time, I can see the model as well, and I can see if I just get this adjusted just right. There we go. So I still can see the root, but I also can see the crest in my divot. So now I'm able to see all of these relationships at once. And if I had a wax-up tooth or a future tooth in here, I'd be able to see that as well. So that's a really nice thing to be able to play with, to get these superimposed models where you can see all the anatomical, all the relevant features at once. So here's the model. This is the patient scan. And again, this slider right here controls the density threshold. Because the roots are usually denser than the bone, by adjusting this threshold, we're able to get rid of the bone and keep the roots. And then, therefore, you can see that relationship between the implant and the roots. Now, there's another feature here called hint. Hint controls the ability to superimpose cross sections of your different surfaces onto the cross-sectional view of the bone. So let me minimize this and take a look. Here's a cross-section through the number 14 site with an implant there. And this is the articulated model. And what you have is a cross-section through the opposing tooth at the correct vertical dimension. So I can turn that off and on. I can turn on marker. And what marker shows me now is, now I know my soft tissue over the implant site. And also, there's that little divot I was telling you about that you saw down here in the little divot that you see here. Now you can see it in the cross section. So this is really helpful in telling you that this particular alignment should be a home run, because you know it's in the apex of the soft tissue ridge because it's in the divot. So that's how you can learn about your soft tissue depth. The labs really like that feature, your lab technician, because they start talking about the emergence profile and all that stuff. And for us to plan the implants, you know, for an upper molar, here we have the opportunity, because we have a generous bony volume, we have the opportunity to place this implant so that the center line of the implant is right on the buccal cusp of the lower molar. And vice versa, when we plan our lower implants, it's nice to be able to see the outline of the upper molar, because we can put the center line of the lower implant on the lingual cusp of the upper molar. And mind you that this is all at the correct vertical dimension. So that's an important piece. So that is how one uses surfaces in terms of manipulating the software. Now the other list is called the implant list. Again, I just did it from a tab over there, but I also can get to it right here. An implant list basically lists the implants. So you have the ID. This is a label, means that this implant came from a menu they have a menu of implants here that you can choose from. We'll talk about that in a minute. That's the label. To ID your implant, you double click on that box, and I'm going to put in 12, or you can put in whatever number you want. I'll put it back to 14. This check mark can make the implant disappear or not. If you have placed an implant and you want to take a closer look at some anatomical feature where the implant is and the implant is obscuring your view, you can turn the implant off to see that anatomical feature. This is the implant abutment. In this case, I put a 10mm abutment on this implant, and that would be down here. Now, I just highlighted that, and I'm going to put a 1, and now I use a 1mm or a 0.5mm abutment as a center line for my implant when I plan oftentimes. You can see how, there is a center line with the implant, but in some sections it may not show clearly, and so it's nice to have this center line. And you can make it as long as you want, and now you can see exactly the occlusal relationship. We'll change it back to 10. So I can make that go away. This is for a guide tube, which is not helpful for planning. And this is a really nice feature. It's a lock. So if you're planning a case, well, if you're doing a single implant case, such as this, once you're done planning it, lock the implant. Because now, you notice I'm moving my cursor over that implant and I can't move it. And especially in the 3D, when you start rolling the 3D around, it's so easy to swing your cursor over an implant that's been planned and move it. So if you do that and you catch it, that you moved it, there's a redo feature right here that allows you to correct the mistake. So I'm going to move this implant by mistake, and now I hit the redo and it puts it back. So the redo feature can save you if an accident happens and you inadvertently move your implant. Again, here's the implant. I'm moving the 3D around. Oh, grab the implant. After you spend a fair amount of time placing an implant, it's not a fun thing to have that happen. I'll hit redo, and I'm back in business. So the redo is really important. But also what's important is the lock. So now with a lock on, I can't move the implant. I can't do anything with that implant with the lock in place. So the bottom line is, when you complete a plan, lock it down. Now, when you're doing multiple implant cases, and especially when you have implants on both sides of the jaw, it's really easy. If you could see here, well, I'll just All right, I'll put an implant here. So it's really easy for when you're, here you are trying to manipulate this implant, and you don't realize it, but you grab the one on the other side of the jaw, and then you moved it. So when you have implants on both sides, you see how from this side I'm moving the implant on the opposite side. And again, let's assume I just spent, half an hour planning a series of implants on the opposite side and inadvertently didn't realize, but I grabbed them and moved them around. So now now this number 14 implant's locked, and I can't move it. So I can play with this one all I want, even superimpose it on the position of the number 14 implant, and I can't move it. So that's the lock. And then this allows you to erase your implant. If you want to get rid of an implant, you can erase it. And I'll do the redo to bring it back. So there's more than one way to erase it. So now you can control the, here's an implant in place. So I clicked on this, and now down here it will show me the characteristics of that implant and associated abutment. And if I want to replace that implant, I can do it by hitting replace. It takes me back to my menu, and now I can just select a different size implant to use. If I want to change the abutment, I use a custom abutment, and so therefore I can just highlight any of these and change the characteristics of that abutment. Now, you also can right-click on an implant, and you have many of the features you have on the right-hand panel would be in this drop-down menu, and some more. So if you wish to replace the implant, you hit replace, just like it's analogous to this feature here. If you want to remove the implant, that's analogous to this X mark over here. And again, there are other, unlock the implant, show the ID. Again, these are all the same things that can be controlled over here. So by right-clicking on an implant, the drop-down menu offers you a number of functions that are very useful. There's a little mark here that allows you to see the implant outline. Because the implants are angled and at a different angle than the slice, oftentimes parts of the implant will be visible in one cut and not in another cut. And so the software will show you the whole implant, but the outline will show you what is actually in that cross section that you're looking at the time. This one seems to be pretty parallel to the cut, so that doesn't really matter for this one. But when the implants are angled, it certainly does matter. Let's see, why don't I, let's see. Okay, I angled the implant on purpose. So now this outline is what's in that particular cut. So even though I can see the whole implant, that's what's in this particular cut. So that's the purpose of the outline. It's a very useful feature, but you still can see the whole implant, even though it's not in that particular section. It's just what the outline shows. And now I'm going to do my undo and bring my implant back to the original position. And you can make the implant, you can change the transparency of the implant as well. So you can make the entire implant more or less. I just made it a little less visible to highlight the outline feature. Now there's another menu over here, implant validation. And this is, depending on what you set over here, this will give you an alarm if the implants are too close. So I don't use this feature, but if you wish to, so here, if the implants, as an example here, are 3 millimeters, less than 3 millimeters apart, the software will notify you that there'll be a little icon, a little label that comes up at the implant, and then if you click implant validation, it will show you which implants are too close together. And the same thing with the nerve. If you mark your nerve, it will do the same thing for you. And so that's a personal preference thing. If you wish to use this, that's fine. I set it at 0 to inactivate it. That's just my own use. So that's implant validation. And I think those are the major, as you get started here, those are the major macros that will be helpful to you. So let's just go back through the logic of planning a case. And why don't we start with this case, which is pretty straightforward. So basically, first thing I'm going to do is I'll go to Panel, Brightness Contrast, as we said before. I'm going to make sure this thing's optimal in terms of the brightness and contrast. Okay. And now I generally start with the pan. And on molars, by default, I usually go with a 5 by 11.5. Not knowing exactly what the bone's going to be, by default, that's where I usually start. So, and in the end, it doesn't matter what implant you place. The guides are made relative to your drills. So as long as the depth is okay, whether it's a Nobel or a Zimmer, whatever, it almost doesn't matter. So I'm going to grab a Nobel replace, a 5 by 11.5. I'm going to indicate it's a maxilla, and hit OK, and I'll place my implant. And basically what I'm doing here is the cut on the pan I want is the one that shows me the full root, and I'm trying to align my implant with the angulation of that tooth. That's all I'm doing here. Now, in this particular case, we're ascertaining future tooth position by using articulated models. So there's a variety of methods for determining future tooth position, because that's obviously the key to planning. You must know future tooth position in order to place your implant appropriately. So given that, I'm going to go to Implant List, and I want to replace the abutment. And I'm going to put on a 10 millimeter abutment, and the abutment's going to be 8 millimeters high. I want to simulate the future tooth, so the molar is going to be a 10 millimeter molar. And again, this is an infinite adjustment. So if it's a small molar, say a 9 millimeter, or a large molar, 11 millimeters, you dial in what you want. The point is that the implant will be centered in that abutment no matter what size it is. So again, this is my first crude shot. The alignment with the root's pretty good. I'm bringing this in contact with the distal of the molar, even though there's the distortion. It's getting me in the ballpark. Again, when you do this, you plan. When you do virtual planning, you do one dimension at a time. So we have to deal with mesial distal, we have to deal with buccolingual, and we have to deal with apical coronal. So then I'll go to the model, which is extremely accurate. The pan can be distorted, as you saw. So now I'll go to the model, and here it's just like placing a denture tooth on a model. I can bring it into contact, like so. So I just fine-tuned my mesial distal. I also can take a look at that relationship between the root by using the patient's bony anatomy. Okay, so now I'm comfortable with my mesial distal. Now I want to get my buccal lingual squared away. And to do that, I'll go back to the implant list. I'll make the abutment 1 millimeter in diameter. I'll go to my cross section. I'll adjust, get this up on the crest. And now I can swing it onto the lingual cusp. So in essence, this implant is pretty close to being placed. What I'd like to see is where I am relative to my divot. And as you can see, I'm lingual to it. So buccal is to the left. I have enough bone that I can move this over. It's hard to discern the apex of a wide ridge like this. And that's why the divot comes in really handy. So now, this is a scroll function right here. And watch this area here as I'm working the cross section. So I'm able to place this in a pretty nice position relative to the apex of the crest. So I'm working here, but I'm looking here, and that's why that's such an invaluable tool, to have that divot and have to be actually see the model itself as you're planning this. Now I want to go back. So now I've got my buccal lingual. It's on the crest, my apical coronal. I want to just double check my mesial distal. So I'll now then make that abutment a 10 again and see where I am. I'm going to make it a little taller. Alright, and it's a little mesial. So I'm going to move it. Okay. Then I'm going to go back and check my center line again. On the lingual cusp. I'm going to replace this implant with a 10. And I think we're in business. And that would be the sequence and the logic of planning a case using articulated models. And again, here's articulated. Although you don't see it down here, you do see the articulated model here. If you want to see it, just click it on. And now you can see exactly, as you would on a typodont, what that occlusal relationship will be. You also can see, by putting the 10 millimeter abutment back on, you get a better view of how the patient will end up, how much occlusion they will have. One thing I didn't talk about was the use of the tangential screen, and let me spend a minute on that. That kind of takes the place, that's like having the cross-sectional screen and the pan screen all rolled into one. So again, if you look at and it works off the axial view. So here's the axial. We're looking at a cross-section through the implant. So what you do is you double click on the implant, and then this little green arm with the triangle will match up. See the little triangle here? That'll tell you which side, buccal or lingual, the arm is on. That triangle is on.
Okay.
And so now I'm going to give you a tangential view. So this is the view you would use. You get it square, get a straight line between the midpoint of the adjacent tooth and the implant. And then that'll show you exactly what the relationship is between that root and the implant, because that's obviously a key thing to know about. And then when you swing it around, you take the slider, swing that arm around. Now the triangle's going buccal. So now you have a perfect cross-sectional view. And you can see again, obviously, the buccal cusp of the lower tooth. You can see the gingiva above the surgical site. And you can move things around. So this is a really powerful tool because you get to see everything 360 degrees around the implant. And that's called the tangential view.